One of the things that we're really trying to do is integrate health equity and anti-racism topics throughout the curriculum during the entire year. And then in addition, during our weekly didactics, different faculty and resident leads for the didactics have been incorporating topics on health disparities in whatever clinical topic that they're focusing on. One of the other things that we're doing in the HERE curriculum is we're doing quarterly race-based caucusing and or affinity groups. And so we're splitting out into a white caucus group and then also to a person of color caucus group. In those groups, we're really just trying to provide a safe space for honest and open discussion around some of the issues of racism in medicine, some of our own personal experiences in addressing those, and also kind of trying to hold each other accountable as well.
So we strive for diversity in our residency because we know that patients have better outcomes when cared for by physicians of the same race or ethnicity. And we also know that organizations are more effective and more creative when those organizations commit to diversity, provide a safe, inclusive, and anti-racist culture. And we want to be that residency for our patients and for our community, for our residents, faculty, and staff. And we're on that path. We have some work to do to reach the goal, but we're committed to get there.
When I first came into residency, I was really interested in working with Native American populations. Unfortunately, there wasn't a lot of residencies that could actually provide that for me. And so what I wanted to do then was work with a very diverse patient population. I'm out at the Harborview Family Medicine Clinic where we work with some of the most diverse patients in the city of Seattle. We work with folks from all over the world, whether they're immigrant or refugee populations. We work with homeless populations. We work with a lot of folks who have a lot of socioeconomic barriers. And for me, working with them and really honestly trying to provide as much help as I can and resources for them has been really, really rewarding.
I think as someone who cares deeply about marginalized populations and increased representation in medicine, I felt that the support from the residency has been really robust, particularly as the Black Lives Movement really picked up in the spring of 2020 as we saw populations get disproportionately affected by the COVID-19 pandemic and institutionalized barriers to their healthcare and racism. The program, I think, was really available in terms of faculty support for writing a survey proposal in a short period of time. And my hope, and I think that really reflects what has always been the case, which is if there is an area of resident interest and passion, that the faculty and the residency will really rise up to support nourishment of that interest or goal.